So that is starting. We are good to go. And one last favor, if you guys, can you guys see the screen that says University of Kentucky Retiree Prescription Benefit? Awesome. Appreciate it. And if you guys would keep your microphones on mute, unless you have a question, you can raise your hand. I can see hands being raised. If you have a question, then I can shout you out, and then we can get your question answered. I like to tell people, if you have a question, then probably everybody else has the same question, or at least a handful of people. So if something's not clear, or if I haven't made it very clear on the screen that you guys can see, please feel free to stop me and dive into something. So thank you for coming. I've heard that there was about 300 people registered for this, for the prescription benefit. So I like to think I'm the most popular one that gets everybody to show up because prescription benefits are probably one of the most exciting things you could do on a Tuesday afternoon. So here we are, and this is the University of Kentucky Retiree Prescription Benefit Fall 2024 presentation. Congratulations for everybody who's here looking at retirement, considering retirement, everything like that. So you've come a long way, and congratulations. If there's anything we don't answer and you don't get a chance to ask a question, or you just don't want to ask the question, you can always reach out to us directly via email at kyrx@uky.edu. And we can answer your questions. We have a pharmacist that reviews that inbox on a daily basis, Monday through Friday, and we tend to get back to people really quickly. What we're going to cover on is the UK retiree prescription benefit for both the pre-65 non-Medicare retirees. Those are people that are quote unquote considered early retirees, or if you've retired but you're still working more than 0.2 FTE. So let's say you're working a few extra hours and it's under the 0.2 FTE and you've retired, then you are eligible for the Medicare retiree. So there's a couple different scenarios that can play out. If you're pre-65, if you're over 65 and you're retired, then you're going to be in the Medicare group. The pre-65 and non-Medicare retiree RX benefit is just like the current benefit that you have as an active employee. Prescription benefit provided for all the health plans, the HMO, PPO, EPO, indemnity, and the Saver High Deductible plan. Same RX benefit for active employees, same RX benefit card. You still have dependents on your plan as a spouse or children if those are applicable to you, and they're covered under the same ID number. This is all administered by Express Scripts, and you'll have an Express Scripts card, which you can see there in the screen. And UK has direct access to enrollment. So frequently, if there's ever any issues with enrollment or anything, the main benefits department will reach out to us and we can manually load people right on the spot. If you ever have any issues, we can definitely help jump in and get those resolved. The Medicare retiree prescription benefit it's a Part D prescription drug plan. You'll get a brand new ID card, usually with an ID number that has a prefix of EE or the letter D. If you have a covered spouse through the Medicare plan, they will not have the same ID as you. They will have a different ID number. Medicare plans are for individual people only. So if you have somebody who's on the UK retiree Medicare plan and they're eligible through your working at UK and you have them on the plan, yes, they're eligible because of your work and your eligibility, but they'll have their own Medicare ID number. There are no dependents on a Medicare plan. Everybody has their own card and own ID number. Looking at how the prescription benefit looks different between the active employees and the Medicare retiree plan, we have them up here in kind of an over-under comparison situation. Kind of one of the biggest things that we see with patients when they move from the active plan or the pre-65 retiree plan to the Medicare plan is their generics kind of get cheaper because there's no minimum. There's no $8 minimum on the drugs for generics. That same $50 cap applies. And You can actually get a 90-day supply uh, through home delivery with Medicare. You can get a 90-day supply at pharmacies other than UK pharmacy and other than home delivery. So you're able to get that 90-day supply elsewhere. It is a closed formulary that we run on the Medicare group, which is a bit different than the active employee group, where active employee group that's not a closed formulary, where most drugs fall in there somehow on that tier three, if it's not called out as a preferred generic or preferred brand. And in the Medicare group, it's actually closed. So drugs have to be on the list to be covered. If it's not on the list, it can get a formulary exception override, in which case it would fall into that tier three non-preferred drug with the 50% and $40 maximum minimum. No maximum on the Medicare side for the tier three drugs. Kind of an operational difference between the two plans when we have the active employee plan versus the Medicare plan. 90-day supply is only available through UK or Express Scripts, Medicare RX plan, UK, Walgreens, Express Scripts, and then there's a handful of independent pharmacies here in Lexington that are able to fill a 90-day supply. We didn't have room to list them all here, but there are many. If you ever have a question or you want to know if your pharmacy can fill a 90-day supply of your medications on the Medicare plan, you can reach out to Pharmacy Coalition at that email or phone number at the top of the screen, and they can tell you exactly what network your pharmacy falls in. Specialty medications are typically limited to University of Kentucky Specialty Pharmacy or a Credo mail order pharmacy. In the Medicare plan, you can use any pharmacy. And one thing to note about any pharmacy is it'll fall into that same percentage copay structure that we saw on the previous screen. However, if you use UK pharmacy in certain situations, it can be a cost saver. So if you're on a specialty medication, maybe something that is typically injected, very high cost, refrigerated, most people know if they're on a specialty medication or not. But if you are and you want to know kind of what the cost difference would look like at different pharmacies, please feel free to give us a call. Healthcare reform as is copay per prescription item. Yes. So when you have here, if it's one prescription and it's a $8 copay, maximum of 50, it depends on the cost of the drug. So you pay a 20% coinsurance with a $8 minimum, $50 maximum. And then in the Medicare plan, 20% coinsurance, no minimum, and maximum of $50. And that percentage coinsurance is based on the cost of the drug. Sorry, there was a question in the chat. I apologize. It says, is copay per prescription item? And yes, it's per prescription. Moving on, healthcare reform, kind of the Affordable Care Act has had impact on prescription drug plans, especially commercial prescription drug plans, not necessarily Medicare prescription drug plans. And there are $0 copays for preventive drugs that are applied to the active plan. Those do not apply to the Medicare plan. A big thing that is unfortunate in the Medicare plan is that the pharma copay card. So when you see a commercial for a drug on TV and they promote their copay card or copay assistance, you can use those copay cards to reduce your copay at the pharmacy down from $60 to $5 or $60 to $0. Those are no longer allowed to be used on a Medicare plan. They are excluded from coverage. Apologies for that. In the UK pharmacy, they offer a 50% discount up to $60. And if those prescriptions are ordered by a UK prescriber and you're getting it filled at the UK pharmacy, that discount is unable to be applied at the Medicare level. And I touched on this earlier with the formulary being open on the UK active plan versus closed on the Medicare plan. There is a question about what is a preventive medication. That was kind of the buzzword in the ACA healthcare reform. It's typically oral contraceptives, so birth control. is $0. There are certain statin medications that are $0 that apply in that case as well. But they have to be prescribed in a certain situation and based on the other medications that a patient is taking. Typically, it's low cost generic medications. There's a handful that are spelled out in the ACA, but birth control and high cholesterol statin drugs are the two that stand out. Uh, Hope that answers that question. Some more coverage differences in the active plan. Diabetic testing supplies can be covered on the RX benefit. There's actually been a little bit of change to this most recently in that it's covered on both the RX and the medical benefit. University of Kentucky Pharmacy Services has opened up a durable medical equipment shop, which is in its kind of beginning stages, where patients can get diabetic testing supplies, continuous blood glucose monitors, and insulin pump supplies filled, and they can process it on the medical benefit, which in some cases is less expensive. We would urge anybody on the active or pre-65 retiree plan to give our office a call if you're on one of these supplies and you're not sure if it should be covered on the RX or the pharmacy or the medical side. In the Medicare world, those are all covered on your United Healthcare card, Medicare Part B. Same situation with the nebulizer solutions. Those are actually covered on the RX benefit. Medicare, it's on the Medicare Advantage on the United Healthcare card. Many oral anti-cancer medications are covered on Medicare Part B that you would have. And new for 2024, 2025, there's many vaccines that are added to the IRA. Inflation Reduction Act had a big impact on Medicare, especially Medicare Part D. And we're seeing a lot of vaccines are now covered on Medicare Part D, with the exception of flu, pneumococcal, hepatitis B, and the COVID vaccine. Those are all going to be on your Medicare Part B, but most other vaccines, think the RSV vaccine or shingles vaccine, those are all covered on the prescription benefit for Medicare. For a specific vaccine, if you have a question, again, give our office a call. We can tell you exactly which vaccine is covered on which side of the benefit for both the active employees and the Medicare retirees. At the bottom, we have 2 vitamins and minerals and cold and cough. These items are covered on the active employee plan. Those are excluded categories by Medicare. So Medicare does not cover vitamins and minerals, cold and cough medications. They're just excluded from Medicare coverage altogether. To reemphasize that UK Medicare RX benefit, it is administered by Express Scripts. They hold the Medicare contract that makes sure that the plan crosses all the T's and dots all the I's and make sure that it is a legitimate Medicare Part D plan. Do not enroll in another Medicare Part D plan if you want to keep the UK Medicare Part D plan. It will kick you out of our Medicare Part D plan. You will be disenrolled. You can only be in one Medicare Part D plan at a time. It's important to emphasize that because every year we get a handful of people who get solicited by the phone and accidentally enroll in another Medicare Part D plan and end up getting kicked out of their UK Medicare Part D plan. Our plan is subject to all the CMS, and that's the Center for Medicare and Medicaid Services, Medicare Part D requirements. So it's at a federal level that our plan is impacted by legislation or anything in that regard as far as rules and regulations. In the UK Medicare Part D EGWP, there is no deductible. There is no coverage gap. In that EGWP, so EGWP, Employer Group Waiver Plan. It's also known as a WRAP. So what that does is it takes the standard Medicare coverage that all plans have to offer, and the UK Medicare Part D WRAP wraps around that coverage and adds more benefits. So that's what you're getting out of enrolling in the UK Medicare plan is this extra coverage on top of what Medicare already offers. And then once you're in the catastrophic coverage, there's $0 cost. So on this next slide is the new kind of groundbreaking updates for 2025. On the left-hand side of the screen, you see the standard Medicare plan where there's a deductible phase, 100% cost share to the patient. That means the patient pays the first $590 of drug cost starting January 1. And then once they hit $590, they pay 25% of the drug cost thereafter until 25% of the drug cost and $590 adds up to $2,000. And then the patient pays nothing else the rest of the year. On the UK plan, there is no deductible, and you start off paying only 20% of generics, 40% of brands with a max of 60, and non-preferred, you have 50% coinsurance. And part of this math, part of this equation is you're getting credit for whatever UK the plan is paying on top of the drug costs. So let's say we get a generic drug at the beginning of the year and it's $500. You pay 20%, so you pay $50 because the max of 50. The plan is paying the other 540, or sorry, 450, but you get credit for all of it. So you get credit for all that towards your $2,000 max out of pocket. In other words, the out of pocket threshold is a maximum that you're going to pay for the year. In most cases, it will be less following this copay structure. This is kind of a new setup for 2024. The good thing is it removes the coverage gap. So it removes another piece of ambiguous cost sharing, but now you actually get to your catastrophic coverage faster being part of the Medicare Part D EGWP with University of Kentucky, and you end up with a $0 cost after you hit that $2,000 threshold. No deductible, and then it restarts again January 1. If you have questions about your specific drugs and want to know kind of how that'll play out, then one of our pharmacists can walk through and kind of explain how much your drug cost, what your cost is, and what would account towards your out-of-pocket threshold for that prescription throughout the year, whether you're in the initial coverage phase or the catastrophic phase. And yes, I will. There's a question in the chat asking, do you mind sharing the PowerPoint with the audience after your presentation to digest all the fine points? Most certainly. I'll be sending this out to Terry Knatzer along with a link to the recording of this, and she will make it available for everybody. All right, so enrolling in the UK Medicare prescription plan. You sign up for Medicare Parts A and B within 3 months of your 65th birthday. You complete UK Medicare Advantage and Medicare RX enrollment form with the UK Human Resources Benefits Department, and UK sends the file to Express Scripts, who sends it to Center for Medicaid Medicare Systems for processing. When CMS approves, Express Scripts sends you a letter with a welcome packet and a new ID card. The biggest take home from this is don't throw it away. It comes in a somewhat nondescript big white envelope. We get a call a couple times a month. Somebody didn't get it. They tossed it. No problem. We can always send a new welcome packet out. That's no big deal. But just a heads up, if you do sign up for Medicare and you're expecting some information, it'll come in a big nondescript white package with your welcome letter and welcome kit all inside. It's no longer a Social Security number based, but a unique 11-digit Medicare beneficiary ID that is unique to you. It's kind of old news. It was effective back in 2018, but just so people are aware, they're no longer using Social Security numbers on these cards. Every month, you will get what's called an explanation of benefits, commonly referred to as EOBs. It's a Medicare requirement that they send this to you monthly, and it shows all of your prescription drug activity, everything that's been covered on the plan, and how that kind of cost shakes out. available online. You can log into your member portal and you can elect to have it sent to you electronically, so you don't have to get the mail every month with it. But this is something that I highly suggest that you get used to reviewing once a month if you have the time, just to make sure that the prescription drugs on your explanation of benefits are medications that you received. Every once in a while, we have a member look at the claims and say, I didn't get any of these medications. And turns out somebody in Nebraska or something, the pharmacist keyed in the prescription information wrong into their system, did a search, and there's some other John Smith with your same name and date of birth out there who's getting medications filled on your benefit by mistake. It's typically always user error or finger faults or something, but it is something just to put your eyes on it, make sure it looks familiar, make sure the drugs look familiar, and you can get rid of it. There's no need to hold on to this forever. They are available on your web portal through Express Scripts. So there's a question in the chat, and it actually plays into this next slide very appropriately. The question is, can you explain the differences for those who plan to continue working full-time at UK after the age of 65? You can most certainly work after you're the age of 65, but you need to be aware that after you turn 65, you're eligible for Medicare, and you need to carry insurance either through UK as your employer, or if you have a spouse that you get coverage from, you have to maintain credible coverage. And University of Kentucky, our HMO, PPO, all of our plans have credible coverage that was recently approved for avoiding a late enrollment penalty for Medicare Part D. And kind of what all that means is you have to have credible coverage through some sort of insurance plan leading up to your Medicare enrollment. So you're not going all these years without insurance, being Medicare eligible, not taking Medicare until, say, you're 75. So let's say you retire at 66, you're eligible for Medicare, but you don't carry any insurance till you're 70. You have these 4 years that built up that then you have to pay a late enrollment penalty for the rest of the time that you're on Medicare. And it's 1% of the standard Medicare D premium. So 1% of 36.78 for 2025 is you'd have a $3.68 late enrollment penalty each month um, added to your Part D premium. And that is for every month that you don't have coverage. So that adds up very quickly and can be quite a bit of money. And some patients, so if you're working after 65, you need to maintain the coverage so you have credible coverage for the years that you're eligible for Medicare, but are not enrolled in Medicare, enrolled in some other credible coverage benefit. And I'll say it again, UK's benefits do have credible coverage. There is somewhat of an issue with kind of the automation behind the letters that go out notifying people that you may have a late enrollment penalty. So we have had members who work at UK until they're 70 and then retire and then go into Medicare D, and they get a notice saying you'll have a late enrollment penalty unless you attest. We can attest to all that for you. If you ever get one of those letters, please reach out to us immediately and we can attest to make sure, because we can look and see that you've had coverage at UK for the past 6 years or 4 years or whatever it may be, and attest on your behalf to make sure that you don't have any of those fees. So it's something to be aware of, and that fits in nicely. If you do, you should sign up for Medicare A. The question in the chat is, should you sign up for Medicare if you are working beyond age 65? You should sign up for Medicare Part A whenever you're eligible. And you maintain, if you're still working more than 0.2 FTE, then you would be in the commercial plan. So here we have a late enrollment penalty. That's kind of if you're eligible for Medicare, don't take it, but then sign up for Medicare at a later date. You have the late enrollment penalty. This is a income-related monthly adjustment amounts. These are paid directly to the Social Security Administration. The late enrollment penalty is determined by CMS, and the Part D IRMA is determined by CMS. So here, this is paid directly to Social Security Administration. If your income-related monthly adjustment amounts in 2023 or 2024, whichever is available, were these numbers, then you would have a monthly IRMA adjustment. This is added on to your monthly premium. So if a lot of people, when they retire, so let's say you retire in 2025 and they look back at 2024, but your 2025 income is going to be far less because you're not working. There are ways to get this adjusted as well. And you can go to the Social Security Administration website to have your IRMA adjustments made appropriately. If you fall into, this category of 262 to 326, if you're married filing jointly in 2024, but in 2025, your income is far less because maybe you both retired and you don't have that income anymore, then you could get your monthly IRMA reduced down to $0. So this is adjustable, but just know that if you're still earning an income while on Medicare Part D, there is an IRMA applied to it. Yes, there's a question in the chat, but HR said we do not have to enroll in D until we officially retire, and they will help to avoid penalties. That is correct. So if you're enrolled in the UK benefit, if you have that credible coverage, and then when you retire, you move into Medicare D, we can help make sure that you don't get any of those penalties, that they're aware that you had credible coverage. On the opposite side of the spectrum, there is low income subsidy for extra help, monthly premium reimbursement, reduced copays on prescriptions. In 2024, you may qualify if you have up to $22,590 in resources and $30,660 for a married couple. There's a website here listed that you can go to that can give you the most up-to-date information. We don't have the 2025 numbers yet. Those have not been published, but they are coming. One thing to call out for members who maybe already be on Medicare plan and they're just here for information or something to keep in mind if you move into the Medicare plan and things to consider is if you ever go to the hospital and you're admitted for hospitalization, that's Part A. It only applies if the patient is admitted. Part B will not cover self-administered drugs, tablets, orals, eye drops, things like that. And that's if, let's say you go to the hospital and you're not admitted. Let's say you're in there for observation. And we see this every year. We see more and more patients go to the hospital, and for whatever reason, they're not admitted. They're just in there for observation. And patients get their maintenance medications, oral tablets for maybe their high cholesterol, high blood pressure, anxiety medications, anything like that. And they're not covered on the Medicare Advantage A and B side of things. And the patient gets a bill for that. We can help patients get reimbursed for those prescription drugs that are filled at the inpatient pharmacy. We can work with you in the hospital to get all those itemized statements to get them submitted and billed to Medicare Part D so you can get partial reimbursement back from Medicare Part D and go into that. It's something to keep in mind that if you ever do have a hospital observation, emergency room visit, and you do receive a large bill for self-administered drugs that are not covered, you can reach out to us and we can help get those submitted to Medicare D so you can get some reimbursement on those medications and you're not out the whole cost of the drugs. A new program in 2025 as part of the Inflation Reduction Act. It was kind of tagged along that $2,000 maximum out of pocket. It's called the Medicare Prescription Payment Program, also referred to as M3P. It's intended to help members smooth out their copay for the remainder of the year if they have a high cost drug initially. So think it's January, you go to the pharmacy and you have one of those non-preferred drugs with a really high cost and ends up being $1,500, let's say. Not to scare anybody, that rarely happens, but let's say it does happen. You have the ability to enroll in this M3P program that then smooths the copay, that $1,500 over the remainder months of the year. So you'd have 11 months to pay that out, February through the end of December. What it also does is it makes the rest of your drugs $0 cost at the pharmacy, but their cost adds to your monthly payment. It's intended to be there for members who are not part of an EGWP plan that have copay caps, better than 25% coverage, and things like that. It in no way reduces your out-of-pocket costs. It does not reduce your responsibility as a patient for anything. It just somewhat smooths it out. And if it happens at the middle to the end of the year, it could result in a balloon payment that gets more expensive as the year goes on, because every time you go to the pharmacy, you don't pay anything, but those costs add to your monthly payment without knowing. As pharmacists here in the benefits department, we think it removes a lot of transparency between your cost, what you know you're going to have to pay that month, and how much you're actually paying. Because the pharmacy, it's no longer that'll be $20, that'll be $0, but then you get a notice how much the drug actually cost and how much is being added to your payment plan. It's like I said, it's intended to help patients who may be on the very high cost drugs at the beginning of the year or on a standard Medicare plan. There's not much benefit to members in the UK prescription drug plan. If you ever have questions about how this could help you or if you should consider it, please feel free to call our office and we can look at your medications and walk you through if there would be any benefit or not. There's no extra contribution to your out-of-pocket threshold, and there should be little to no need for members to enroll in this program with the UK Medicare EGWP. There are other ways to reduce your cost, such as low-income subsidy plans, or that reduce premiums and copays. Those actually do reduce your out-of-pocket cost, but this program does not do that. Kind of the summary, Part D in a nutshell is right here on this page. Enroll in Medicare AB regardless of employment 3 months before your 65th birthday. The Medicare plan resets 1/1 regardless of when you enroll. I know it's unfortunate if you enroll in November and you start applying to that $2,000 maximum out of pocket and then it resets January 1, but given it's a Medicare plan, we have to reset 1/1. Low income subsidy helps you with your Medicare costs. That actually lowers your cost. A late enrollment penalty increases your premium. Just making sure that you attest to having credible coverage or actually maintaining the credible coverage until you enroll in Medicare. IRMA is another adjustment to your monthly premium based on income. Explanation of benefits, it can be received electronically or via mail. My advice would be to review that every month if you do get frequent medications, just to make sure that it's yours and nobody else is on there. Self-administered drugs that require manual claims, reach out to our office. We're happy to help with that. Coverage gap is gone. Nobody should ever tell you you're in the coverage gap or the donut hole or anything like that. Catastrophic coverage is when you hit $2,000 at most. It will most likely be less than $2,000 for anybody in our plan. But once you hit that $2,000 threshold, $0 the rest of the year. Vaccines covered either Med B or D. You can call our office to determine which ones, if you're interested in getting a vaccine, which ones are covered on which plan. But majority of them are covered at $0 cost. The M3P program is new for 2025. It will not reduce your cost or offer any extra help. It's not mandatory, but it can be a smoothing mechanism. And lastly, if you have any questions about your medications, cost, formulary status, coverage, or just want to talk with a pharmacist, we're here Monday through Friday, 8 to 6 p.m. And our number there is at the screen. Here's kind of our list of pharmacists that are here on the team at UK to help patients navigate the whole Medicare Part D, the prescription benefit once you retire if you're pre-65, and just kind of how everything works. We do outreach from the KYRX office. So if there's disruption for the new year, maybe a medication is being removed from formulary or a medication is recalled, our pharmacists will get notification about who's on which medications and will reach out to members prior to being impacted. Or if you get a letter from Express Scripts about a change, we also follow up with a phone call so you can talk with a person about what's going on. And with that, that is all I have for the presentation part of today's show. There's a question about the premium for Part D, and the premium for the Medicare Advantage plan, the Part D plan, it's all wrapped up into one, and it's paid to University of Kentucky. It's collected through direct bill, and the Medicare officers will be able to tell you exactly what those premiums are. We will stop the recording here in a moment. Oh, another question coming in. You said you need to enroll in Part B regardless of employment. But if you are not retired, I've always been under the impression and told that you need to enroll in Parts A and B, regardless of employment, 3 months before your 65th birthday. I would definitely reach out to the main retiree officer here at UK about A and B. Our focus is strictly on the Part D side of things, which happens once you're enrolled in the Medicare plan. So I apologize for not having a definite answer on that, but that's what I've been told from various Medicare retiree officers. If you're retiring before you're 65, you can stay on the commercial plans that are available to the active employees until you're Medicare eligible. I'll say because somebody asked if you're retiring and you're only going to be 63 years old, will the HMO stay the same? Um, you're still eligible to be in the HMO until you're 65, and then you would roll in the Medicare Part D into the Medicare plan. Will they set up monthly billing? Somebody put in the chat that you can always email retirement@uky.edu if you have questions about kind of when to enroll in what part. That would be great to direct kind of those when to enroll questions. And then will they set up monthly billing? That would be a question for them as well. I know it's done through direct bill, but I can't tell you if it's automatic or not. I apologize for that. And with that, I will end the recording. We will send this out to all participants, and I think everybody who registered a link to the recording, as well as the slides for people to digest on their own time. And our contact information will be in there for you to reach out to us with any questions or concerns you may have. Thank you all for your time. I appreciate the attention and all the questions that you gave. And everybody have a wonderful day, and congratulations on even thinking about retirement. That's awesome.